Most days is a struggle. You come into work and there's a long wait, which I say I don't like to see.
Resus.
Oh, is this the lady? When you do a 10-hour shift with no breaks, no nothing, it just becomes a problem.
10:30 a.m. in Rotherham's emergency department. 25 patients are already here. There's one more bed left. In resus, 4 of the 6 beds are full.
We see times when we can't actually get any patients through the door at all, and we're queuing ambulances, and that's when I get stressed, when I cannot actually, you know, if the red phone goes, which it went a few minutes ago, which is our emergency phone, we've got a pre-alert coming in from an ambulance, we now have got no resus bed to put them in, that's when I get stressed.
And then the red phone goes again.
What is it?
It's a placenta previa. She's 35 weeks bleeding. Apparently they can't get hold of her.
So the problem now is resus is full, I've got red phone going off, so we've got to now make that decision of who do we move out of resus to actually get this poorly patient in. There's loads of trolleys on the back, pinch from. At the moment we've got 5 ambulances here at the moment, but we've got a full department, full resus. I've got no resus beds, no actual trolley space, so any other ambulance now coming in is going to start queuing unless we actually get some beds or anybody discharged from the department.
And nobody could be discharged because the hospital's wards were full, so Paul Greenway was moved from resus to a corridor.
You're having to wait in the corridor now because the place is full. Did they explain that to you?
I didn't know that. I just got shot out of this cubicle so fast, they were unbelievable. But there's more important people than me to come in here.
And today's performance figures from NHS England show just how desperate the situation is across the country. A&E attendances in October were the highest ever. 2.17 million patients turned up for treatment. Ambulance call-outs for the most serious cases, they hit nearly 84,000, and the waiting list has now reached 7.1 million. Trolley waits were record-breaking too, and when we met Jane Betts, she had reached 20 hours in the emergency department waiting for a bed.
I've been here since yesterday at 3:30.
And are you okay here?
Yeah, I'm putting up with it. It's just, you can't complain really when you're getting looked after, can you? So.
But you feel looked after?
I do, yeah. It's not ideal, but it's just how it is, so. It's free. That's all I think, so you can't really grumble, can you?
People keep talking about the new normal, but this isn't new. It was happening well before COVID, the winter all year round, the pressures that are unsustainable on the NHS. And the sad thing is, when you talk to the staff and when you talk to patients, they seem to just accept it, that this is the way things are now.
Today's figures show that across England, almost a third of patients weren't seen in A&E within the 4-hour target. By mid-afternoon in Rotherham, the wait was 8.5 hours. The only light relief was for Snoop, the therapy dog, whose owner had been brought in by ambulance and was being taken for his constitutional by a waiting paramedic. The Health and Social Care Secretary admitted today these were challenging times, but it transpires the £500 million promised by his predecessor to speed up discharge has yet to be distributed.
I'm just wondering if I can actually, are we getting anywhere with IDT patients on Fitzwilliam? Because we've got a few beds blocked with IDT now.
And that's what's causing problems at Rotherham. Too many patients coming in, not enough going out. Bright infographics in the hospital's control room tell a bleak tale.
So when you're looking at this, what are you thinking right now?
Currently the organisation's on level 4, which is the highest escalation level, and our wheel shows us where those pressure points are. So it's in terms of capacity, so our bed capacity, and then as you've seen in the emergency department, it's busy down in the emergency department. But as you can see, our admissions are higher than we'd expect in a typical day, so our bed demand is higher today.
And they have other problems, not only threatened strikes, but staff retention. Dr. Kay Stenton, our emergency department consultant, tells us she's retiring next year at the age of 55, like large numbers of doctors driven out partly by punitive pension tax rules, and that is a whole other story.
So the NHS is going to lose you?
Potentially. But I think a lot of people are looking in particular at retirement and maybe taking retirement early because of the stresses.
And the pressure is all too obvious. The ambulances keep arriving, carrying the patients who need care and treatment from the staff who are always waiting at the door.
Well, a little earlier I spoke to Chris Hobson, NHS England's Chief Strategy Officer. It does feel like the NHS is breaking records for all the wrong reasons at the moment. I mean, 7.1 million people on the waiting list in England. The Royal College of Nursing it feels the need to take a strike action for the first time in its 106-year history. Ambulances taking an average of 1 hour, 1 minute and 19 seconds if you've had a stroke. That's extraordinary.
Well, we know that the elective backlog that's been caused by COVID-19, we know it's going to grow for a period of time. But let's not forget, Fatima, that actually we agreed a plan and set out that plan really clearly earlier on in the year. We said that we wanted to concentrate on recovering the backlog from those who effectively have had to wait the longest. We actually hit that first milestone for 104 weeks in July. We're now making, and today's evidence, absolute statistics show this, we're making good progress in terms of the next milestone we have to hit, which is 78-week waiters by next March. So yes, there is a huge amount going on, but yes, you're also right to identify that the service is under pressure. But look, one of the reasons I wanted to kind of come on and do the interview with you is to just make clear how hard NHS frontline staff are working, to be very clear that everybody in the NHS knows that it's their job to provide the best quality of care possible. But yes, it is very challenging out there.
I mean, we all appreciate how hard the NHS staff are working, and that's clear from the film that we're showing tonight. But would you accept that the NHS is now at its worst point in history?
Well, I think everybody tries to encourage us to kind of make those comparisons in terms of, you know, worst in history. Is this the worst ever October? Because the figures are both September and October. What I would say to you is I could completely flip the question round and say if you actually look at the amount of activity we undertook in September, we've actually had one of our second most productive month ever in terms of the amount of operations and tests that we've done. But yes, there is no doubt that the NHS, and you can tell this when you talk to frontline staff. I mean, I talk to frontline staff, I talk to frontline chief executives and leaders every day of the week, and there's absolutely no doubt that there is a very high degree of pressure.
I mean, it has somehow become normal to expect to wait an hour for an ambulance. And when you speak to patients in A&E and they've been waiting for hours and hours, the reaction is almost, well, this is the NHS now. I mean, is this a process of managed decline?
No, I don't think it's a process of managed decline. I think every single person who works in the NHS wants to provide the best quality of care to every single patient who needs it. And I wouldn't accept that, you know, those kind of delays to access care have become normalised. Everybody is working hard to ensure that we provide timely access to high quality care.
Well, given that NHS staff are working so hard, the nurses, the junior doctors and everyone else involved, shouldn't they be better paid?
Well, the amount of pay that is paid to NHS staff is a matter for government, and there is an independent pay review body that makes recommendations to the government, and it's the government's decision about whether they wish to accept those recommendations or not.
So the bottom line is, you need more money, really.
The bottom line is that the NHS's job is to work within the financial envelope that the government allocates. That's always been the NHS task. And what we know we need to do is to ensure that we have the right long-term workforce in place. That's why we're working on a workforce strategy that's been commissioned by the government. And we know that whatever the context, the job of frontline NHS staff is to provide that best possible quality of care that they can given the context. And that's what they're doing. But I think we all need to acknowledge, as I said, that it is a challenging environment, but NHS staff are doing the very best, as you would expect them to do.
Chris Hobson, thank you so much for joining us.
Thank you.